the doctor that I work for now, she has such a strong bond with her patients, as did you and Rick. And it really does give our patients reassurance knowing that I've been with her for almost 8 years. It's not somebody that's sort of like passing through. And sometimes, patients know that even if it's something very complicated, if they come in to see me, sometimes it's the fast track to see the doctor.
Welcome to the CoachMD Podcast. I'm Dr. Charles Glassman, bringing you 3 decades of experience as a physician and a coach. Join us as we navigate the maze of medical advice with real-life stories, empowering you to take charge of your health. In our That Happens segment, guests share transformative experiences, reminding us that we're all human and not just patients. So get ready for a journey into healthcare reimagined, where empowerment and discovery pave the way. Hey, it's Dr. Charles, aka CoachMD. In my over 30 years of medical practice, I've made it my goal to help people create strong minds, healthy bodies, and unshakable spirits. And that's why I launched the CoachMD podcast, because I wanted to bring to my audience, to people who listen to podcasts, just a different way to look at medicine, because most people, honestly, they don't always get the best advice from their doctors. You have to kind of get a lot of information yourself, bring it to your doctor, and have your doctor kind of guide you and give you their opinion or their expertise, but not necessarily taking care of you, because you really have to be given the tools to be able to take care of yourself, to empower yourself. And that's how I always looked at myself as a doctor, giving people tools and not just looking at people as patients, as being sick and just taking care, throwing out medications. No, empowering people to help them take care of themselves in wellness and to stay well. And so my guest today, we have a lot to talk about, is Ann Marie Hembrough, Annie. And Annie and I go back a long way, because Annie started as a physician's assistant in our practice many years ago, and a crackerjack physician's assistant, I have to say. Uh, um, and she was the really the first physician's assistant to help us. And I've worked with physician's assistants throughout my career. And I remember when I was an intern in surgery in the Bronx, New York, I I would look to the physician's assistants in surgery, vascular surgery especially, to kind of show me the ropes, because a lot of times the doctors were too, they really weren't too busy, but they may be too uppity, if you will, to be say it nicely, to deal with the interns. And I would look to the physician's assistant. So um, Annie was cut out of that mold, and knows a lot about a lot of different things. So Annie, thank you so much for coming on the Coach MD podcast
Oh,
today.
I'm so excited. You know how I feel about you, and I'm honored to be here. So maybe we can impart a little bit of wisdom from all our years of collectively working together and then
Yes.
years apart.
Yeah, yeah. And there's a lot to talk about through all different aspects of medicine. And when Annie started with us, we had an internal medicine practice, and that's what I did for my career. I was an internist, and internal medicine is basically a family doctor for adults. Okay, you deal with all sorts of things, and I think tell us a little bit, Annie, about your background before you started in our practice way back when, and then kind
Sure.
of some of the things that you might have gleaned from working with us.
So I grew up in Pearl River here in Rockland County, and my dad had this great doctor in this great practice by the name of Rick Handelsman. And I met him a couple of times, just, when I would go out with my dad. And I had lost my mom when I was young, and it sort of guided me to work in medicine. And when I was in PA school, my dad said, "Hey, why don't you see if, Dr. Handelsman, or you'd say Handelsman and Glassman,
Right.
if they would, do a preceptorship for you." So I asked, you guys said yes. and it was great. It was, it really is the backbone of medicine, if you will. And for me, and I think for all mid-level practitioners, I think it is critical to work at least for 6 months to a year in internal medicine, because it really does provide the basic knowledge that you use in everything,
Mm,
because after I left you guys, when I got married, I went up to Boston and I worked in thoracic surgery, and I used a ton of my medical background then. And then I took, a couple of years off when I had my babies, but then I worked in plastic surgery for a few years, which definitely we used the medicine when we would clear people for surgery, and I took care of them, made sure that they were taken care of, before surgery, that they were good to go, and then afterwards. And then I found my true love, which is dermatology, and that's where I've been sort of ever since.
yeah.
So I'm now at the Skin and Laser Center in Ramsey, and I love it. It's great.
Yeah, awesome.
So,
Yes. So these places that Annie's talking about. So uh, Rockland County, where I live and used to practice in internal medicine for many years, is about 30 miles north of New York City, and the Ramsey, New Jersey, is right over the border in New Jersey, and these are places in the New York metro area. And we see a lot. Everybody sees a lot everywhere because, unfortunately, people get sick and have to learn how to stay well everywhere. That fortunately have to stay well
right.
everywhere. Um, Now, just as a physician's assistant, I want to kind of tell my audience a little bit about what that means because you said you did internal medicine, then you did thoracic surgery. I talked about when I was in the Bronx in my surgical internship that I was with physician assistants who were scrubbing for surgery, who were doing things in the operating room, and some my audience may think, what's that? They're not doctors, so like, what's going on? Like, what do they know? Where do you get your what's your educational background? What are you learning? And how do you work with the doctor? Because I know, but my audience doesn't.
Right. So PAs, physician assistants, and you'll see PAC is basically the terminology, and the C stands for certified. So we always talk about board certification. No matter what specialty you're seeing, board certification is important.
Mhm.
So I went to Stony Brook, and when I went to Stony Brook, I had my undergraduate degree. And then I went to Stony Brook for 2 extra years, 2 complete years, no summers off, no vacations. That has shifted a little bit in terms of the educational components. Some of them are now, undergrad and your PA school in one. And when I graduated, I essentially graduated with two undergraduate degrees. And PAs first were developed at Duke University. And they were developed because all of these medics came home from the Vietnam War. They had all these skills. Nobody knew what to do with them.
Mm,
So they developed this program. And really, what PAs were originally developed for was to try to fill a void to help keep the costs of medical care down. So I'm not sure if that's succeeded, but it really was the goal of it. And as a PA, you really are guided by your physician mentor. So when I worked with Dr. Glassman and Handelsman, I worked in internal medicine. When I worked in thoracic surgery, I worked doing what a thoracic surgery PA would do. So it really is dictated based on what specialty you're in. So in internal medicine, I would see patients, do physicals, colds, coughs, blood pressure, and basically you develop a relationship with, um, you know, so your supervising physician knows what you know. So
mhm,
I think one of the greatest compliments that you guys ever gave me is you said that I feel comfortable with what you know and that you feel comfortable with what you don't know and you come and get me. And I think as a mid-level practitioner, whether it's nurse practitioner, midwife, PA, we have to be comfortable with knowing when we've reached our limit. And so that's, where we go to the doctor. And that's why it's called physician assistant.
Hmm.
It really is a great and unique partnership, but you just have to really build that partnership and really feel comfortable with it.
Yeah, that's great. The idea of partnership, because that's what it really is. And, my experience is that so many times that, and I talk about this on my program all the time about common sense. Doctors, unfortunately, would get so much into the academia and great cases and, oh, that's a great case. And you forget that you're really, you're dealing with people, all right? And you gotta kind of walk it back a little bit and use your common sense and use, what are you doing in your life? And my experience, PAs, they're very, you're very good at doing that because, not that you're not educated, but sometimes medical education is not, there's so much, you're so much in the weeds,
Sure.
and it's not, you can't really apply it. And I'm all about things that work, not just the theoretical, things that work in life, whether it's, a certain type of mindset, that's working, whether it's a certain type of supplement that you take, does it work? And so if you're dealing with patients, people, is your physician patient relationship working? Is your ancillary staff, your physician's assistant, are they filling the void correctly and having a relationship with patients that you may not have time to see all those patients, and you're at least allowing people to have not to be turned away, to be able to get into
Sure.
the office and talk with someone who's very knowledgeable, very experienced, and knows kind of what to do. So yeah, that's basically what the way I see physician assistant. And Annie, in our practice years ago, we ended. It was a great. We had a great time
We
because
did.
we have mutual respect, and also respect for our patients. We would never, ever have a person come into our office and have them see someone who we didn't have confidence in. And,
Right.
and so you want the physician assistant to be respected by their mentors. And so that to be reflected in what the responsibilities they give to the physician assistant. And
Right.
if that's the only person you see in a doctor's office, most of the time that means that the doctor has enough confidence in that person to allow them to have that relationship. So I think it's very
Sure.
important, and it
Sure.
does fill a void. As far as costs go, I'm not sure, right
Yeah.
right now, but it certainly improves access to care, which
Absolutely.
is so important.
I mean, even now, internists, I mean, you're seeing, sometimes 10 or 6 to 10 patients an hour, maybe somebody every 10 minutes. And say, a patient calls up and is like, I really need to talk to somebody, is there somebody available that can, I can talk to quickly? This happens all the time,
Yeah.
even what I do now. And sometimes, the doctor isn't able to get on the phone, especially if it's a surgeon you're working for. So it's great to have access to somebody who can really answer questions sort of now this minute. And
Yeah.
sometimes you need those things.
Yeah, definitely. And certainly a physician assistant. I would encourage my audience not to be, I guess, cautious and say, "Oh, I couldn't even see my doctor. Oh God,
Right.
oh, I called the office. I want to see the doctor, but I can't," because you have to realize that the doctor wants to see you, wants to have access. So uh, there's two things. One is you want to have immediate access
Right.
when you're sick. You definitely want that, but the doctor's office shouldn't only be about sick care. It
Sure.
should be about well care, about staying strong and healthy. And so, a doctor a lot of times doesn't have time to sit down and talk about those things that really can lead to empowering you and staying well. And sometimes the ancillary staff, okay, the
Right.
physician's assistant, the nurse practitioner, are there so they can take that time.
Yeah,
And yeah, I think that's important. I'm sure you've experienced
absolutely.
that.
And
Yeah.
I know too, with the doctor that I work for now, Dr. Lieb here in Ramsey, when she has such a strong bond with her patients, as did you and Rick, and it really does give our patients reassurance knowing that I've been with her for almost 8 years. It's not somebody that's sort of like passing through. And sometimes patients know that even if it's something very complicated, if they come in to see me, sometimes it's the fast track to see the doctor.
Right.
So,
Right.
don't
Yeah.
tell people that.
Right.
So sometimes, we have to do to get patients in, right? And get them taken
Yes.
care of. So I think that really is a great way to incorporate some extra provider help in an office.
Yeah, that's a great point that you make because I would encourage people who are listening that if you are reticent to see you call up and the doctor can't see you, but the physician assistant can. And you say, well, when can the doctor see me? Oh, next week. Don't wait until next week. Go in, see the physician assistant, and as Annie was saying before, that if she knows her limitations. So if you come in with the issue that you're really sick and it's something that she doesn't feel comfortable with, you're in the office now.
Yeah,
She's obligated and the physicians will go out, tell the doctor we have this person. So you're in the office now being seen right away for something that you might have been seen a week ago, taken a
sure.
week, and that delay could be not good. So that's a really important point.
Yeah, but I think, and that's something that I have always felt really strongly about with mid-level practitioners. They need to know their limits. They need
Yeah,
to not be uncomfortable with saying, "Hey, I don't know this. I need my doctor." And
yeah.
I've been very blessed. I've always known my limit.
Yeah. Yeah. Most as Annie's talking about, most physician assistants have such great experience. So, like I said, I was working with physician's assistants back in the mid 80s in the Bronx, New York, in surgery, vascular surgery. So Annie was in Boston as a physician's assistant for thoracic surgery. Okay, I mean, you can't understand really unless you've done that, the amount of experience and knowledge that you obtain just hands-on. I
Yeah,
always tell people that I didn't become a doctor after medical school. In fact, I joke around, the best time actually to be a doctor is between medical school graduation and start of internship, which is about a month,
right.
because you're an MD, you have no responsibility. You just have an MD after your
Yeah,
name. So that was like the greatest 4 weeks of
yeah,
my life. Hey, I'm a doctor. Just don't somebody pass out like you see on Seinfeld or whatever,
yeah,
and say, "Oh, is there a doctor in the house?" But
yeah.
I became a doctor when I was an intern and resident because I'm in the hospital. It's hands-on. It's direct experience. You have to, a lot of times, pull upon just common sense
Oh, yeah,
and so you learn most hands-on and physician assistants, that's one of the strengths. They have a lot of hands-on clinical experience before they are treating people or uh,
absolutely.
managing patients, whatever. So yeah, it's great. So your journey has taken you many places: internal medicine,
Yes,
thoracic surgery, plastic surgery, and now you've landed in dermatology. And I do want
yes,
to talk about dermatology
yeah,
because um, I always and I'm all about, as we know, is well care. And I'm all about taking care of oneself and empowering information so one can do that. And so I'd like to talk about dermatology because some of the controversies in it and some of the things that you do, the cosmetic things that you do,
Sure.
the preventative things that you do, and what would you say it is your one recommendation? Okay, if you had to give one recommendation as far as skincare and skin health, what would you say is your number one recommendation?
Skin
If there's,
checks. I
okay.
mean, skin checks hands down, because a lot of times people think, oh, this is just a mole or this is just a pimple. Well, that pimple hasn't gone away in 6 months. That's not a pimple. So I think the important thing is skin checks. So above and beyond skin checks, sunscreen. I
Mm,
mean, with the ozone layer depleting the way it is, we really need to wear sunscreen. And people get caught up like in the number, like, oh, I'm using a 100. It really just needs to be an SPF of 30 or greater with zinc and or titanium. Those are physical blockers to the sun.
mm,
And those are critical. And where everybody will tell me I wear sunscreen. Everybody says that. I'm like, but you have a tan. And they're
mm.
like, well, I go out in the sun. I said, well, do you reapply? So I think where we lose people is with the reapplying. That is really where most people I think fall a little short, because I test myself out every summer. I'm like, okay, I'm gonna get this sunscreen on. We go down to Long Beach Island. I'm like, I'm gonna go out there. I'm gonna see like what's going on here.
Right.
And I will put sunscreen on every hour and a half, and I will come home as white as when I left. And I'm, as you know, very fair complected. So if I can do it, everybody can do it.
Yeah.
Uh, because a lot of people will say, no, it doesn't work for me. I just get tan, whatnot. It's reapplying, huge, huge.
Mm.
So
Now,
sunscreen
yeah,
and
go ahead.
skin checks.
Okay. Now the zinc and titanium, you said that those are the base, and those are natural. I mean, in a way,
Yeah,
I mean those are
those are natural.
those are
Yep.
natural. So because
Yep.
there was all that talk about certain brands
Right.
last summer or the summer before,
Mhm,
could you
mhm.
talk a little bit about that? The kind of the controversy in different sunscreens, whether they're good for you, whether they're bad for you. Is there, what if you can
So a
give us a
lot
little
of
bit
that
of that?
was debunked, or
Okay.
all of it was essentially
Okay,
debunked.
good. All right.
But the biggest thing I think that people always say, what is the best sunscreen for me? My answer always is the one you're going to use.
Right.
Because if you put on a cream sunscreen and you don't like it and you're not going to apply it again, well, that's not your best sunscreen. So ideally, if you can avoid the chemical sunscreens, they still work.
Yeah.
That's what a lot of the spray sunscreens are. Now they've introduced more of the zinc and titanium spray sunscreen, so you can make the switch over. Um, but if you have to be comfortable with the one you're using. If you're not using it, it's not the one for you.
Mm,
And people always ask, well, what about my scalp? There are sunscreens that you can put in the scalp. However, I don't think it's enough. I don't
mm,
think you can really adequately part. I don't think anybody's really getting in
right.
there, parting their hair. So you really do need a hat.
Mm,
That's the
yeah.
only sunscreen that I really think is not great. They haven't really made enough strides with that.
Mm,
But you can feel safe using your sunscreen. If you have any doubt whatsoever, just look for zinc, titanium. That's it. Those are
mm,
the two buzzwords, zinc and titanium. That's all you need.
yeah.
And they're
Okay.
very cosmetically elegant these days. People are always like, oh, I'm going to be so white. They're very cosmetically elegant.
Yeah. Oh, good. Excellent. Yeah. And yeah, the sprays are so much more easy to
Yes.
apply, but you just have to apply them, I would imagine, a little thicker than just a mist on your
Correct.
skin.
I mean, you have to really,
Yeah.
you have to really put, a shot glass of the cream sunscreen is what you put for the whole body. So you got to really be generous with, you got to really apply.
Yeah. Wow.
Sorry, we're all ringing over here.
That's okay. If
Um,
if you have to get that's no problem.
no, that's okay.
Okay.
So yeah,
Um,
you have to really, really apply. I think
mhm.
that's where people fall short.
Yeah.
So it's the reapplication.
Okay. Yeah, and so okay, so why is that? Like what tell us a little bit about now what happens to the skin with the effect of the sun, because a lot of people say, well, I want to raise my vitamin D level, and that's the
Right,
most natural way to do it. So if I'm putting on the sunblock and I'm not getting enough vitamin D, isn't that
right.
going to hurt me in one way, another way? So how do what about that? And also, what about the damage? What's, why do you put on sunscreen? Yeah, that's,
So the reason that we put on sunscreen is because it can cause changes in the skin, which will result in skin cancer. And there's three types of skin cancer. There's basal cell, squamous cell, and then the one people die from, which is melanoma.
mm,
So melanoma you can get not only from, the sun increases your risk, for melanoma. There is a hereditary component of that, but people can die from it, and people do die from it.
yeah,
We don't have a lot of great advances in the treatment of melanoma once it becomes metastatic.
mm,
So very important to really get the sunscreen on. Basal cells and squamous cells, yes, you will have a cancer, so to speak, but if you get it cut out, you get stitches put in, the worst that happens is you have a scar. So that really is the reason that we push sunscreen. And, you just have to ask yourself what's more important, having a tan or, having skin cancer.
yeah.
One of my girlfriends in California, she used to tell me that, hey, Annie, tan fat looks thinner than white fat. I was like, I know, I get it.
That's funny. Um,
Yeah.
so what about the vitamin D part of it?
So, yeah, that's a great
Yeah,
question
yeah.
because when I lived in Southern California, we actually would test people on their vitamin D levels. And now we all know that Southern California is sunny all the time. And we found that a lot of people were still deficient in
Mm,
vitamin D. And so I said to the doctor that I was working with at the time, and her feeling is that because of all the environmental pollutants, that our food is not as naturally enriched with vitamin D
mm,
as years ago.
hmm
So I think it's because we're not getting as much internal from our food sources like we did in the past. So we still discourage people from, going out there and getting their vitamin D, so to speak. You can get it from vitamins or food.
mm. Yeah, and I think that I myself take a supplement of vitamin D, and I
Right.
try to get my level, around 50 to 70, which you need supplementation for that. I don't think you can get that in the sun anyway.
Right.
Um,
No.
yeah, to get it at that level. So, um, what about darker skin? What about people who are dark skinned?
Still
As
very
far as
important.
Okay, so that's important to know because a lot of
Yes.
people, we have, African Americans, people with darker complexions,
Right.
Latin countries.
Yeah.
I think it's a misnomer. People think, oh, I'm protected because I have all this natural melanin in my skin. It's protective, but as your experience and your
Oh, yeah.
knowledge is that's very important that they still need to use sunblock as well because they have
Absolutely.
similar risk.
Yeah.
Is the risk similar or is it
So the
is there
risk is
difference?
a little bit different. There is a little
Okay.
bit of a protective effect. So we know in medicine, in dermatology, that getting those like two or three really bad sunburns a year is worse than sort of having like that base coat. But you still are at risk. You're
Yeah.
still at risk.
Yeah.
So it's still very important, and people who have darker skin types, they still can get burned. You
Yeah.
may not see it, but they feel it.
Yeah.
So it's a misnomer. People really do need to use sunscreen. And listen, even my own daughters, I have one daughter, she lives in Southern California. She's lathered up all the time. And then I've got another one, she'll text me. She'll be like, hey, Mimi, look, I'm getting a tan. I'm like, so,
Right. Yeah.
I mean, it's hard. And I think that, the younger generation, they all want to be tan, which, listen, I get it looks nice, it's great.
Yeah.
But the self tanners have really come a long way.
Mm,
So I really do encourage my patients to use self tanners.
mm.
Sure.
Yeah.
You know,
So, obviously, the sun exposure, like anything else, exposed to the sun and the elements, it causes oxidation, it causes
Yep.
hardening and breaking and cracking. Like
Yeah,
if you leave a hose out in the elements, it's going to harden up, it's going to crack, and so that causes changes. And as we get older, it causes changes to the skin. So
sure.
part of your practice is, as you're saying, the bare bones as far as the skin checks and encouraging people and treating skin cancers. But I know that your practice also does a lot of cosmetic
We do.
dermatology. So if you
Yes.
could kind of bring us through a
Yeah.
little bit of that and what that looks like.
Absolutely. So the sun causes sort of the breakdown of collagen and elastin, which are, the building blocks to help keep us looking, more youthful. And so as we get more sun exposure as we age, that causes the fine lines, the wrinkles. As we get older, we lose bone and we lose fat, usually in the face.
Mm,
Uh, First, when we're younger, our face is an inverted triangle, with this being the widest portion. As we get older, we become more rectangular, which is a
mm,
more aged look. We sometimes get hollowed out in the temples. So we get the jowling. So all of these are signs of natural aging and sped up by the sun. So we do offer in our office a wide variety of cosmetic procedures,
mm.
because it's really what people want. People want sort of that endless fountain of youth. We are also very conservative in the office in the sense that we don't want people looking like they live in Southern California.
Right.
So,
Right.
we want to keep
Yeah.
our, great Jersey look. Uh,
Right.
so, there's various ways that you can go about that. Usually the starter is doing Botox. Botox is a purified protein derivative, which stops the movement of muscles. People always say, can you get sick from it? No, you can't get sick from it. The nice thing is, if you don't like it, it wears away in a few months, but that's also the downside because people want it to last forever.
Yeah.
So there is maintenance to it. Then, sort of the next step up is graduating into fillers. And there are so many fillers now that, we could talk for, a whole podcast just on fillers.
Yeah.
Sort of the basic ones that you jump into first are made of hyaluronic acid, which is a basic chemical that's found in our body. It's water loving, it attracts water. And it is something that helps, does what it says, fills up the area.
Mm.
And there's, like I said, there's so many of them, and there's so many different companies.
So let
So,
me just stop for 1 second. So like Botox and the fillers,
mhm,
those are mainly geared toward taking the filling up so there's no wrinkled, like so I haven't had Botox. So I have, wrinkles in my forehead, okay?
would
If
be
I had both
Botox.
Right, if I had
Yeah,
Botox, it would get rid of those wrinkles, right?
right.
And
It
I
helps. I
probably
always tell people it softens the wrinkles.
okay.
And if it gets rid of it, that's what we want. But, I tell people, because sometimes people come in and they're like in their 70s. I'm like, it's going to soften,
Right.
not going to get rid of it completely.
Yeah.
And sometimes people think like, oh, if I do Botox, is it going to make my lines and wrinkles worse? And the answer is no. But the problem is the aging process continues. We're just masking the symptoms. So I've had
Right.
people after like 4 or 5 years, they're like, I'm gonna stop doing Botox. I'm like, okay. I'm like, however, and I try to explain to them,
Yeah.
they'll come in 3 months later, the Botox made my lines and wrinkles worse. No, you just continue to age. So
Right.
it's masks what goes on.
Right. It's kind of like Rogaine for hair loss. If
Yeah,
Rogaine can help keep, some hair growth, but
yeah.
if you stop it, you actually go back to where you would have been if you hadn't taken it at all. So you lose all that. So,
I tell people
um,
what would have fallen out will.
yes,
So
yes, yeah,
don't give it
exactly.
up.
Right, right. So, and the fillers expand the
Mhm.
wrinkles or the around. Yeah. So
Yeah,
that yeah, no, I can see it. But so that's kind of the okay. So go ahead and tell us a little bit more about some other things, and then because I want to talk a little bit about other things that
sure.
we could do besides that, besides the
Absolutely. So
actual
then like the next
interventions.
step is sort of getting into procedures, whether it's using radio frequency, doing laser resurfacing. There's all sorts of like, light treatment to help treat brown and red, pigmentation. And there are so many machines, so many companies there's a lot of overlap essentially.
Yeah.
And then there's also machines that help to get rid of fat, like cool sculpting. So
Mm-hmm.
there's various things. And then after that, you're talking about plastic surgery. So it's sort of that gradation.
Hmm. Yeah. So, and with Botox, and I've seen this before, unless you're going to someone, I mean, you have to go to someone who has expertise doing it
Right.
because there are some complications that can happen.
Yeah.
Like, you see people with their eyebrows, like
Yeah.
up whatever, and
Yeah.
it looks weird. So what kind of uh, complications what have you seen, in your experience?
So one of the biggest things that everybody worries about is, are they going to get a droop? So I've only had one patient that got a droop for something I did. And it ended up being, was actually, believe it or not, a coworker who had some unusual anatomy because I did her Botox, she got a droop. Then 3 months later, somebody else did her Botox, she got a droop, same side.
Mm,
So, you know, and that's one in, I can't even tell you how many people I've Botoxed
yeah.
since 2006, a lot. But the main things that people will notice when it comes to Botox is either they, will say, I liked the positioning of my eyebrows, or I would like it to be a little bit higher, or, you know, usually what people say is they want more. That's usually
They didn't
the
get
impression.
enough. Right. They didn't get
Right.
enough.
Like, because
Yeah.
I'm conservative and because I
Hmm.
want to sort of ease people in. I don't want them to go home and be like, oh Lord, look at this, especially
Yeah.
if it's their first time. And the nice thing is I'm able to develop a relationship with my patients. Going back to that, as being a PA, we develop relationships. And
Hmm.
so I get to know my patients, and they feel comfortable with saying, Annie, I'm not sure if I like this. Let's do this. So it's about a recipe. Botox is a recipe.
Yeah.
And the biggest thing I tell people, please don't go get Groupons. Don't Groupon your Botox.
Right.
Please don't Groupon, because
Right.
you want to go to somebody who has a lot of experience. That's
Yeah.
huge. And board certified, board certified.
Yes. Yeah.
Those are the key
Because
things.
I know that there are companies that offer for doctors weekend
Yeah.
courses in Botox. And so as things get, stressed and doctors may not be making the kind of money that they thought they'd make or want to make, they end up going in the side business of doing some cosmetic and don't have experience like you have. So here we're treating the effects of aging. I'd like to kind of talk a little bit about what one could do now from the inside out. Now, you
Or
mentioned the basis of skin being collagen, which is the most ubiquitous, the most prominent protein in our body. And I know that myself, I supplement with collagen. I have been for the last several years, and I take about 20 grams of collagen a day, type 1 and type 3 collagen, from, trying to give my body the the components that it needs. So, like you're saying, if somebody has Botox and they say, I don't want to get it anymore, a year or two goes by and now it looks worse. A lot of times it's just a natural process, like you said, of aging, but it's also possibly not providing the nutrients that one needs from the inside. So the aging process accelerates. If you could just talk a little bit about that.
so I think that one of the biggest things that I've started to learn more about is sort of the second brain, the gut.
Hmm.
Um, and so I think it's really important for people to put into their body things that are going to reduce inflammation because
Hmm.
I believe that inflammation is the catalyst for all disease.
Hmm.
And so I think the aging process also that goes along with it.
Yeah.
Now, when it comes to collagen, I don't know if I can really say that orally is going to make a difference in what you're seeing on the face.
Hmm.
In fact, I think one of the most important things for the skin on the face in terms of aging is what you're putting on it. One of the things that is a ride or die in my life is tretinoin, which is a medication people know
Hmm.
it for acne, but what it does is it causes skin cell turnover and keeps bringing up the more youthful skin. So I think that alone, if someone said, what is the one, besides sunscreen,
Hmm.
what is the one anti-aging product? If I had my, choice between collagen or tretinoin, hands down tretinoin.
Hmm.
But I think in terms of what we're the way our skin will react, whether it's acne or rashes, or any of diseases that manifest on the skin, I think it's really important to minimize inflammation. So I
Hmm.
think that's kind of where collagen can come in, sort of provide some of the building blocks to help, plump up some of the collagen.
Hmm.
But I think reducing sort of the white foods, sugars, things like that will minimize inflammation, reduce acne, potentially reduce any allergy type rashes. So things like that, I think, are really important to do. Really, what
Hmm.
in your body will reflect on your skin.
Yeah, so that's a great point. Now tretinoin, like retin A,
Yep.
yeah, that sort of thing, which is a derivative of vitamin A. So it's a type of vitamin that you're kind of putting on your skin. And what you're talking about, what we put into our body, and a lot of us, see that as we get older, the body stores fat, more readily, and fat cells there it does, people don't like the way it looks and they say, oh, I'm too fat, I'm obese, but there's something more sinister in fat cells. Okay, it's they secrete cytokines, and for those that may be watching this and the word cytokines, you say, gee, I think I heard that somewhere. Well, you heard it during the COVID craze, right? When COVID hit us, COVID-19 in 2020, people who were getting sick and dying
Right.
were were exposed to this new novel virus that the body hadn't seen before, and it was causing what's called a cytokine storm. And what that means is that these components in our blood, it signals that something's wrong. We have to recruit immune cells to fight it. But the cytokine storm, it overdid it. So it was a hyperimmune response. And that causes inflammation. And that inflammation affected the lungs and the brain and all sorts of things. And so that's what the cytokines do. So when we're obese, it causes we have cells that are actually bioactive. They're secreting these bad things. So not only does fat look bad, but it's actually causing more inflammation in the body, and that could affect our skin. And I know, Annie, that's why you kind of started getting involved in a way to help your patients lose body fat.
Right.
So because if you don't, you could do all the cosmetic and skin stuff you want, but if your body is in this constant state of inflammation, it's going to cause the outward appearance, the phenotype, how we look, but inside the genotype, okay, or well, that's the genetics, but what's happening inside is really getting affected by that fat. So if you could kind of tell us your journey, okay,
Yeah,
about how
sure.
you started looking at things that might help that. So, in the downstream effect would be to help the skin, but you had to understand that without getting rid of some body fat and those cytokines, the inflammation is just going to continue.
Yeah, absolutely. So a few years ago, I realized that, at 5'3", it being my height, that I was 146 pounds. And I'm like, when did that happen? And I think the statistic is as a woman, you gain 10 pounds a decade. And that's really where I fell to. I was really small when I was in high school and college. And my primary care provider, which happens to be a PA, Michelle Tuzolino, great, great gal. She's like, Annie, she's like, your numbers, your A1C, your cholesterol, your blood pressure, your glucose, they're all trending upwards. And I was like, what in the world is going on? Because
Mm.
I was still kind of wearing the same clothes, but they were definitely snug.
Hmm.
So I was like, what happened? So I was determined that I was going to lose weight. I was like, I don't want to go on medication. I don't like to take anything. So I did it all. Got a personal trainer. I did keto. I did paleo. I did Weight Watchers. I did it all. And the needle just was not moving. And I remember someone saying, you can't outrun a bad diet.
Mm.
And I never thought I had a bad diet because I was like, you know what? I wake up and I don't eat anything till 2 o'clock in the afternoon. I
Mm.
have my tea, but I don't eat anything. And then I have some like sandwich and then I have my dinner and then I go to bed. I'm not really eating that much. But that's a bad diet. Overeating is a bad diet. So I remember seeing my girlfriend on Facebook and she had lost weight. And I'm like, all right, I'm going to bite. What'd you do? Because I was desperate at this point.
Right.
Like, the personal trainer, I had lost inches, scale didn't move, the numbers weren't moving. And a year had gone by. My primary care provider was like, I think you've gone up in your
Mm.
numbers.
Wow.
So it was where I was, feeling like, boy, next step is going to be blood pressure medications and or possibly medications for diabetes, which was a hard no for me.
Yeah.
So I was lucky enough to meet up with my girlfriend. She got me on this program, and I've been really sort of, drank from the Kool-Aid ever since, and it's really been life-changing for me. The other catalyst was I was having really bad heartburn.
Mm.
So once I lost all the weight, heartburn went away. My numbers were perfect. Every year I go back, numbers are right on track.
Wow. So what is the program?
So the program is called Optavia.
Okay.
And basically what it is, the premise of it is you're going to eat every 2.5 to 3 hours. And you're going to eat the fuelings that they call them. So all these little mini micro meals, snacks, whatever we're going to call them. And then you have your one lean and green meal a day, which is specified, portion control, specific vegetables and specific proteins. And it's in a calorie deficit because at the end of the day, when people say
Right.
calories in, calories out, they really mean it and it really is true.
I
There's
agree.
no
I
way around it.
agree. There's no way around it. And
No.
I don't care. I know. I just from my experience, my life and my personal and professional experience has told me exactly that. So I know, you hear a lot of experts, okay, who say, well, it's really the quality of the calories you take in. I know many people who are well above their optimal weight eating much more than they need to survive, who are taking in quality calories, who are unhealthy, you
Yeah.
know. And
Yeah.
so yeah, so that's so the calorie deficit, that's the only types of diets that I've seen really work.
And the
So
important
yeah.
thing is like people always say, well, it didn't seem like you were eating that much. What people don't realize is when you don't eat every 2.5 to 3 hours, your body goes into starvation mode. It's
Mm.
like, well, I don't know when I'm going to get food again, so I'm going to hold on to everything that I've got. So that's exactly what was happening. My body was literally in starvation mode, holding on to every morsel that went into my mouth. and I just couldn't lose weight.
Mm.
So once I started eating every 2.5 to 3 hours, so when I first wake up, within a half an hour, I have my first, fueling as we call them, which is always a shake for me because I'm not really ready to eat food.
Hmm.
And then after that, every 2.5 to 3 hours. And I lost the weight 3 years ago. And I've managed to keep it off because I've, really taken in those principles. And people always say, don't go by the number. You have to go by the number just a little bit. So
Yeah.
I weigh myself once a week just to see where I'm at.
Hmm.
And I really am able to stay within it. Another thing too, I don't drink alcohol.
Yeah.
And I don't think people need to give that up. But
Right.
alcohol goes back to the inflammatory, things that we put into our bodies. Some of those things can cause inflammation.
Mm.
And listen, I'm not talking about like if you're going to have like, red wine to help with your lipids, sort of, as we know, can help in that capacity. But, I think, people that are imbibing more than they should, that's causing inflammation.
Yeah.
Um, so
Well,
for
I'll
me,
even just to say about the red wine, because that can also be a big problem because people will say that, oh, I just have a glass of wine. I'm doing a glass of wine every night. Not only is it excess calories, but it does cause changes in the liver and the
yeah,
liver with lipid metabolism. So in the long run, it's probably not a good idea to have a
yeah,
drink a night. It probably isn't. But anyway,
yeah,
go
I
ahead.
agree with that.
Yeah.
I remember, when I was still, working for you, um, our favorite cardiologist, I'm not going to
Right.
mention his name.
Right.
I had to go into his office and I said, hey, I'm like, I have a patient. He's really overweight and I can't fit the blood pressure cuff on him. And I said, what do I do? He's like, you can't take his blood pressure. And I remember that scaring me because I kept thinking, this guy is going to leave our office and we don't know what his blood pressure is because he was so obese.
Mm.
And I remember thinking that there's got to be a way for us to help patients with that.
Yeah.
Uh, but sort of fast forward, one of the things that I even encounter in my practice, even though, I know it's dermatology, but I do take care of kids who have bad acne and we put them on Accutane and we have to check their cholesterol. There's a lot of kids out there with high cholesterol.
Yeah. Yeah.
And it's really sort of taboo to talk to anybody about weight. And so I'm curious, like, how you feel about that topic. I mean, how do you feel providers, whether it's internists, or medical providers, can talk to patients that way without the patient feeling sort of body shamed?
Right. Well, that's the whole thing now. Everybody is, afraid to say things because you're gonna body shame them. But you have to be realistic and talk about the realistic aspect of body fat.
Yeah,
And what I was talking about with the cytokines and fat in the body, excess fat will secrete bad stuff in the body and cause a constant state of inflammation. And some people are desperate, and I do want to go over some of the specifics about what you're talking about, the Optavia. But
yeah,
what I'm cautious about are the new medications that are out there, which aren't so new, the Gila Monster derived medications. And I say Gila Monster because they're the Ozempics and the Mongeros. These were discovered. It was Byetta was one of the first by studying the Gila monster of the deserts of in the United States, and they discovered because these lizards will eat maybe, I don't know, 6 to 10 times a year. And so by studying their saliva, they found this component, which is a GLP-1 agonist, which causes the body to not need to take in food, to suppress appetite. And so a lot of these medications, which people are running to now, and doctors are writing the prescriptions because it's so much easier to write a prescription than it is to engage in somebody about lifestyle and eating. And so they take these injections or the pills, some of them are in pill form, and they lose weight. They lose a lot of muscle weight though. And so they're not that safe, and most people are going to have to be on them for the rest of their life because they're not making the changes in their lifestyle. So when you when you say you have to eat every 2 hours, now, do you stay on this program and eat only their food, or do you learn how to prepare your own food or what to take so you're eating every 2 hours? Because we know that in order to maintain this sort of thing, you have to maintain it. You have to keep doing the same thing. You know, you have to keep on it. So what does that look like?
So what we do is once they've reached their goal weight, we transition them, or we want to transition them.
Yeah,
What a lot of people do is they're like, "Oh, I've lost the weight.
yeah,
I'm gonna do me."
yeah,
And 2 months later, they call us back up again. But the transition, which and all my clients that have transitioned, they keep it off because they're really invested in the whole picture.
yeah.
So when we transition them, it's over a 3 week period where we start to bring back fruit, we start to bring back whole grains. So we transition from 4 fuelings a day plus one lean and green meal a day to three and two, 4 and 2, and then you go 3 and 3. So we each, as the weeks go on, we bring back 3 meals a day with snacks in between. But you're still going to keep doing the every 2.5 to 3 hours.
Hmm.
That is critical because if you let yourself go too long, what happens is you're ravenous and you'll like sort of grab whatever you have. And at the end of the day, one of the biggest things that people have to incorporate is meal prep.
Yeah.
You have to meal prep. With with families with both parents working, if you don't meal prep, you're not going to stick with it. I mean, it's so easy to come home, put on pasta, put sauce on it, and call it a night. And people need to embrace the fact that the more protein they're going to eat, the more they are going to be full.
Mm.
So the fuelings that we have are balanced between protein, a little bit of sugar, and a little bit of carbohydrates to really keep you feeling satisfied. And once you start the program, and sort of around day 4 is when people start to feel amazing because they've really sort of detoxed from any kind of preservatives, sugar, things like that, and they really feel good.
Mm.
And it enables them to continue to eat healthy and make good choices. They don't want to cheat.
Yeah.
That I think sets this apart from other, and we don't even call it a diet, we call it a health plan,
Hmm.
or a life plan because we really want them to incorporate it. It's you're not hungry. My clients are always fascinated when they're like, "Yeah, really, I'm not hungry on it." They get that normal hunger right before you're going to,
Hmm.
but they're not ravenous.
Yeah.
Um, and now we've actually started with a program that's designed for people that are on the weight loss medications to help maintain their protein, reduce muscle loss. So we have something for everybody.
Hmm.
Uh, this company originally was geared towards people who didn't exercise, but that's not the case. So we have something for everybody. I've got, hardcore athletes on it. I have people that don't even want to walk around the corner. Uh,
Hmm.
but the one thing that I do try to incorporate as time goes on for those people that don't exercise is you need to get active because we all know that's the fountain of youth. And the issue with it is if you don't exercise, you really are limited as to how many calories a day you can actually eat without gaining weight.
Right. Right.
So you have to exercise so you can eat.
Yeah.
Uh,
Right.
you know, it's funny. I follow this girl on TikTok. Her name is Kate Noel. I think she's like 27 years old.
Right.
And I'm fascinated with her because she's a little irreverent at times, but she's like, I went out last night and I had 7 drinks. So now I have to run a mile for every cocktail I had. So she holds herself accountable and
Yeah.
she says, if I am going to imbibe, I got to pay back. So
Yeah.
she will, for every drink, she runs a mile.
Yeah.
Uh, this other influencer that I follow, she is talking about her daughter. She has a set of twins. One is heavy, one is like a toothpick, and they're 13. And the young girl is going through all those changes and she's leaning out. But people are giving this woman a hard time because she's saying that she's teaching her daughter about healthy eating choices and the things that she should incorporate into her lifestyle. And I'm like thinking, we tell our
Yeah,
kids, brush your
yeah,
teeth,
right.
wash your face. Why is it wrong that we sort of guide children into eating healthy? Like
Yeah, right.
that's important. That's what we
Yeah,
should do as a parent. You're
yeah,
setting them up for life if you teach them, how to eat healthy, right?
yeah.
But it's like a little taboo still.
Yeah. Yeah. Well, it's a whole thing where people are afraid to shame somebody and make fun of them and whatever, but you're not. It's honest. It's just being truthful. So, you're taking people who most people think they look at other people and they'll say, "Oh, I don't eat as much as that person." Well, that person is taking in way too much, and then so if you're comparing yourself to that person,
Yeah.
you're taking in too much too. So it looks like what sounds like this diet does, it ratchets it down to
Yes.
a caloric deficit, and
Yes.
then when you transition, you bring them
Mhm.
back to a baseline caloric intake, but that baseline caloric intake is going to be way lower than they did before because whatever was being done before was too much. And
Absolutely. Yeah.
so you have to come back and realize and I one of the pieces of advice that I give is that get like something like My Fitness Pal. So
Yeah.
before you start any eating plan or diet, don't do anything for about 2 weeks. Enter everything that crosses your lips into that and see what your caloric intake is,
Shocking.
because whatever that is, it's too much. And
Oh,
so
100%.
then you dial it down and you have kind of a something to go with to kind of as a barometer. So when you
Sure.
do start going again, you know not to go up to that point. So
It's interesting. I was just the other day, so 2 weeks in a row, I went to dinner to steakhouses. And one of the biggest complaints that my clients, before they go on, will say, well, what do I have to do if I go out? I said, well, the easiest thing you can do is order a petite filet. It's the exact portion that you need, as one of the weights. And so I did a little test. So last week I went to a steakhouse, got a regular petite filet, how they would cook it. And you can see the butter on it and whatever. Then the week later, I ordered same petite filet. I said, no butter. It came out, couldn't taste the difference.
wow,
Tasted great.
yeah,
I didn't, I mean, if, and in all honesty, the one with the butter killed my stomach. I
yeah,
mean,
right,
killed my stomach.
yeah,
Yeah.
yeah.
So, going out, you can still, even if you're following a healthy lifestyle, you can, even on this plan, you can still go out to eat and stay true to the plan.
Yeah.
Uh, and it really is, I feel so passionate about it because I just want to help more people who feel like they've tried everything and nothing has worked.
Yeah. So
Because,
you'll leave us, you'll send me some links that I can leave in
yeah,
the description if anyone wants to get more information. Just,
yeah,
one thing before we wrap up that I'll say in along those lines is that one of the best things you can do, like you said, go eating out. The next day you don't eat, you're going to need to take in, like, let's say you take in more than you usually do.
right,
You don't dump the same amount this next day. So if you go out to dinner on a Saturday night and you take in way more than you're used to or you thought you were
right,
going, don't have a brunch Sunday morning and
right.
Sunday night, don't have a big Sunday dinner. Or if you're eating dinner,
Absolutely.
cut it back. So those are the things that people pile on, and it gets it really adds up. So
Yeah. Well,
yeah,
that's
Anne
the funny
Marie,
thing. That's
sorry,
the
what
funny
is
thing, though. A lot of my clients will say, I went on vacation and I still lost weight. I said, see,
yeah,
because you're it's an average, right? It's not
Yes,
some of one day. It's an average of what you're doing. So,
exactly. No, great points. Annie, it's so great to see you
oh,
again
great
and to
seeing
catch
you.
up and having a
Yes,
conversation and
great.
look forward to many more. So
Yes.
thanks for coming on the Coach MD podcast.
Thank you. And if
And
any of your, anybody listening that wants to get a hold of me, they can, find me on Facebook and Instagram, and we'll send you, that information. So,
excellent.
and they can contact me that way for sure. Because I have
Beautiful.
you know, public
Ex
sites. So,
Excellent. Love it.
all
So,
right.
yeah, well, thanks everybody for joining
Awesome.
us on the Coach MD podcast. You know me, I'm Dr. Charles, aka Coach MD. And until next time, I'm urging you to stay strong in mind, in body, and right here in soul.
Love it.
Bye for now.